Dr. Jesse Rossow again here with Kennedy Vision Health Center, and today I want to talk about kids' eye exams. I have a lot of people who always ask me, when should I bring in my kids for their eye checkups? And I see a lot of kids that are not brought in for exams until they're 12, 13, 14 years old, and they have issues that have been untreated for years. And so I always try my best to educate parents to bring in their kids when they're younger, and I'll explain more about that right now. So basically, we are able to do exams on babies, anywhere down to a newborn. Obviously, at that age, they're not able to respond to us and tell us what they're seeing, or tell us which is better, one or two. But we are able to get an idea of what they are seeing at that point, make sure that their eyes are lining up properly, and just make sure that things are in working order and looking good. Sometimes kids can have, especially babies, can have eye diseases or, things that they're born with, eye misalignments or things like that, that the earlier we catch them, the better we can treat them. So it's important to actually bring in your kids when they're very young and not waiting until they're in their teens before we see them. So, like I was saying, bringing in kids when they're younger is important. The AOA actually recommends ages 1, 3, and 5, and every year after that. And of course, by the AOA, I mean American Optometric Association. But so ages about 1, 3, and 5, and every year after that. And that's if they have no problems or diseases. Of course, if we saw something wrong, we'd want to see them more frequently. But and studies have shown that actually a third or more of kids in school age may have vision issues that affect their learning and affect their lives. And so if you're not bringing them in to get checked out, we can't find the problems and we can't fix them. School screenings are not exams. Many people think that they are exams. No, they're not. They're basically just checking to see if a kid can read 20/40 or better. 20/40 is not perfect vision. And even if they're seeing better than that, that doesn't mean they can't have eye issues. They could be farsighted. They could have eye diseases that are not showing up in their vision. There are many other things that can present with good vision still. So that's something that I always try to point out as well. So, as far as kids go, a lot of times they don't know anything better. They were born that way, or they've always seen poorly out of one or both eyes, so they just thought that was normal, and they didn't say anything about it. And, so bringing them in is the only way to check things out and make sure things are healthy, and we'll do a great job of explaining what's going on, telling you how they're looking, making sure that things are good, and if there is a problem, we'll treat it for you. If they have a lazy eye or something, a lot of times they don't know. They just know that that's the way things are, and they just accept it. And so unless we're checking for that, we don't know if it's happening. And the earlier we catch it, the earlier we can treat it. So again, bring them in for an exam, check things out. Most insurances cover a yearly eye examination anyway, so you might as well use it, and we'll give them a full workup and figure everything out, and you'll know what's going on, they'll know what's going on, and we can treat problems if they're having any issues. So if you have any more questions, feel free to contact me or anyone at Kennedy Vision, and we'll be happy to get back to you and answer those questions. Otherwise, I hope you have a great day, and thanks for watching the video. Bye.